Hello, everybody. It's nice to see everyone again. Welcome to our 2021 webinar series. This is our last webinar of the year, everybody. Thank you so much for joining us. We hope you've enjoyed everything in our programming through the year. We are so glad you've been able to join us all year. We look forward to giving you more programming next year, but we are heading into the break and we are ending it in high style with Michelle MacDonald from National Jewish. And she is joining us again today. Michelle, thank you so much for joining us. Dietary supplements and nutrition, a topic many of you have asked about, and we're so pleased to have you here today. Thank you. Michelle is a clinical dietitian and certified diabetes educator at National Jewish Health in Denver, Colorado. She provides compassionate, comprehensive nutritional care to adult patients with various chronic conditions, including bronchiectasis, cardiovascular disease, chronic kidney disease, chronic obstructive pulmonary disease, gastrointestinal disease, interstitial lung disease, NTM lung disease, obesity, rheumatoid arthritis, scleroderma, and type 2 diabetes. We may have missed a thing or two in there, Michelle. Michelle works closely with a multidisciplinary team of specialty clinics, counseling both inpatients and outpatients, and she's very dedicated to helping patients use nutrition as a supportive therapy to manage disease and optimize health. Michelle completed a Bachelor of Science in Human Nutrition at Cornell University, a Master of Science in Food Science and Human Nutrition at Colorado State University, and a dietetic internship at the University of Northern Colorado. Welcome, Michelle. So today you can drop your questions into the Q&A box. You'll see that little icon on your screen. You type your question into the box, hit send. At the end of the presentation, I will be reading out questions for Michelle to answer. We'd like to thank InsMed for all their support for our programming this year. We can't do what we do without support from InsMed and from people like you, and we really want to thank everybody for supporting us this year. It's been our pleasure to bring you all of this programming, and we're so glad everybody has enjoyed it. Don't forget to follow us on social media, Instagram, Facebook, Twitter. You can also learn more and sign up for the latest news at ntminfo.org. And of course, YouTube. Don't forget to check out our YouTube channel. If you've missed any of our series from this year, you can watch any of our webinars. You can catch up on them. You refresh your memory by watching them. Michelle, thank you for being with us today. The floor is yours.
Thanks, Amy. I need to share my screen. Okay, I'll do that now. It should stop your screen, Amy, from sharing. Okay, here we go. Okay, can you see everything okay?
Yes, we can.
Okay, so I'll get started. I think this is a hard topic, but probably one that is applicable to almost everyone I see, in the sense that most people that I see in clinic with bronchiectasis or NTM-LD, and honestly, most people I know are taking one or more supplements. I tried to make this concise. I also tried to include things that I really wanted everyone to know, but I imagine there are a lot of questions. And I will also start with a disclaimer that there are way more supplements that I could ever know anything about. And it's challenging, and they're also ever changing. So I think, as always, it's important to know what resources you can check for good information regarding supplements. And I'll try and provide some of that today too. Okay, so let's get started. The overview is we're going to start with just a little bit of background. I'm going to start with a statement or two about the Dietary Supplement Health and Education Act in 1994, because I think that changed the landscape for nutrition, the nutrition supplement industry. I want to identify 6 red flags that Consumer Lab actually identifies, but I strongly agree with. I always talk to people about the first 3 because I see them so much, but these are just red flags regarding what you should look for with supplements. And then Consumer Lab had 3 other good ones, since they review, I think they've reviewed over 6,000 supplements. So they've seen a lot as well. So I thought that would be good for people to know who are interested in supplements. And then I think at our last webinar, we talked about maybe me talking or providing some recommendations about what supplements you may want to consider. And I would say I probably went a little conservative here. because I tend to be a little skeptical when it comes to supplements, and I think you'll understand why after we discuss. But I put down my current thoughts on that. Okay, so to get started, I think it's worth being aware of the Dietary Supplement Health and Education Act of 1994. It created a new regulatory framework for the safety and labeling of dietary supplements. It really was, like, in my opinion, maybe a bit of a sea change in terms of the supplement industry. As a result, the FDA is not authorized to review dietary supplement products for safety and effectiveness before they are marketed. So that's concerning to me as a consumer, as well as me as a health professional. And additionally, under this act, herbal and all other dietary supplements, vitamins, minerals, and otherwise, are subject to a much less rigorous, if you can read that, I know the red's hard, they're subject to a much less rigorous oversight process than pharmaceutical products like drugs, for instance. So just because something is in a bottle and has a label on it and has a front panel with claims made on it doesn't necessarily mean that it's legitimate or of good quality. So this particular act, in my opinion, does not put the consumer interests first, unfortunately. And so I think there should be a lot of skepticism and wariness when it comes to dietary supplements, because there's not good oversight. And why I always recommend that people look for supplements that are third-party certified. Okay, so let's move to the 6 red flags. The first one is what I just mentioned. A lot of times, or for most supplements, I actually would say for most supplements, there's unknown certification. So you can't tell by looking at the supplement product whether or not a third party that's objective has checked the supplement for quality. And what I mean by that is there's another party that doesn't have an interest in the supplement manufacturer's well-being to check whether or not the supplement contains what it says it contains, vitamin D, for instance, in the amount listed on the label. 1,000 international units is in the case of vitamin D3, for example, and checks to see whether there's consistency between batches. So between bottles, do they contain what they say they contain, and is the amount listed on the label accurate, no matter which bottle in the batch is made? So you know that one bottle is representative of the other ones. Are there contaminants present? So this is probably one of the big concerns, in the sense that the literature is pretty full of heavy metal contamination, whether that's lead or mercury or other contaminants in supplements. That is problematic. And then also, will the supplement actually break down and release into the body properly so that you can absorb what it is that's in the supplement and hopefully make good use out of it and get the benefits. So I tell people to look for the certification marks, and these are the 3 common ones. You'll see Consumer Lab on the right, USP sets the industry standard in the middle, and NSF. Those are 3 of the ones that are very common. There are other ones. I prefer people to stay with one of these 3, if at all possible. And that's hard to do. It excludes a lot of supplements. Let me back up. The exception to this is there are large pharmaceutical companies and other supplement manufacturing companies that are sufficiently large and sufficiently have had a long-standing reputation. They don't have these third-party certifiers on them. So for instance, I think Bayer makes a Citracal that I take. I'm pointing to my drawer or my cabinet where I keep it. Bayer is a large pharmaceutical company, and they say that they have an internal quality control department that checks supplements for everything that I just mentioned. And they basically say that we're following the USP standards. They still don't have an objective third party certifier looking at a lot of things unless you'll see it listed, say, on Consumer Lab's website. But I think in some cases, some companies are too big and they have too much to lose, and they do have internal departments that are doing good work, that to some degree you can trust some of the bigger supplement manufacturers. And I kind of look at supplement manufacturers on a case-by-case basis, but a lot of people come to me with Swanson vitamins, and I contacted Swanson, and I decided based on their years in business and the size of their business that they were probably trustworthy, even though they didn't necessarily have one of these third-party certifiers on their front panel. But I always tell people, just as another extension here, so consider the manufacturer, consider whether or not there's a third-party certifier. I think it's best if you do have a third-party certifier, and then consider if there's any question, because a lot of people are considering supplements that don't have the big supplement manufacturer behind them or the third-party certifier. I really tell people to watch out for supplements that are made, unfortunately, overseas, India or China, because those have been cited in the literature, as I mentioned, as having more of the contaminants that could be potentially harmful. So moving on to the second red flag. A lot of times supplements offer too much of an ingredient, and you are then getting too much without realizing it. So what you should know is that supplement labels are not required to disclose when the amount of an ingredient may pose a risk of harm, and most won't disclose this voluntarily. So what I see a lot of is that a lot of supplements will have more than 100% of the daily value, and a lot of them have megadoses, which are 500% or more of the daily value. Both of those are potentially problematic. And then lastly, I also see a lot of supplements that essentially contain ingredients that exceed a tolerable upper intake level. So a tolerable upper intake level is something that is set by, it's a US standard, and it essentially is the level at which, higher than that tolerable upper intake level, you are at risk for adverse effects from toxicity. And most people don't know, or it seems to me that most people don't know these tolerable upper intake levels exist, and they don't know what they are because they're not on the supplement, and it's not in the supplement's best interest necessarily to advertise that. So whenever I look at supplements, I look for the manufacturer, I look for a third-party certifier, I look for the amounts actually in the supplement, and I'm frequently excluding supplements because they just contain large doses of the ingredients. Okay, so as examples, zinc happens to be one of the common culprits that I see lately, because zinc came into favor with the COVID pandemic being a potential immune booster. And the tolerable upper intake level, again, set by the US, is 40 milligrams per day. I can go walk to the store across the street and go find my 50 milligram per day zinc supplement in no time at all. It's very common. And it's not something that I recommend, because zinc at high levels like this, above 40 milligrams per day on a daily basis, can cause nutrient deficiencies, like a copper deficiency. That's actually pretty well established in the medical literature. It can cause GI upset, and it could also interfere with antibiotics that you might be taking. It's a cation, which means that when it's ionized, it ionizes in a 2+ fashion, and it can potentially limit the absorption and utilization of antibiotics that you might be taking, among other minerals that can ionize like this. So I'm pointing that out because I'm seeing that now more so than ever with COVID. I see a lot of biotin, so I wrote that one down here. The RDA for biotin is 30 micrograms per day. I regularly see people taking 5,000, I believe, milligrams. My gosh, I think that's what it is per day. Let me see if I have. Okay, I think that's what it is. And that is such a huge dose, and it's based on anecdotal, meaning people reporting that evidence that their hair, skin, and nails improved. And I have people tell me that it helps them in that fashion. And for those people, I generally allow them to make the decision whether or not they want to continue it. What I would just tell people to be aware that 5,000 is way over a megadose. And we now know that high levels of biotin in the blood can actually change your lab values of other markers or metrics. So for instance, what we're seeing is that allergy-specific IgE tests are falsely lowered with high biotin levels. We're also seeing changes in people's thyroid levels with high biotin concentrations. And so it can actually make you falsely look like you either don't have an allergy or that you might have secondary hyperparathyroidism or a thyroid dysfunction, when it's just a false reading because of high levels of biotin. So if you're taking that much biotin, you don't think it's helping you, I would probably stop. I even encourage people to try and stop, even if they think it's helping them, to see if it makes a difference, because I think there's potential to do harm. And then with vitamin C, I see a lot of people on large megadoses, whether that's 1,000 milligrams at a time or more, or day or more. And the tolerable upper intake level, actually vitamin C is 2,000 a day. And it's complicated, but one of the things I like to tell people is that your body's only going to absorb about 250 milligrams at any one time. So you're not going to make use of that higher dosage, even if you're taking it. You're enriching your urine, basically, with vitamin C and potentially other water-soluble vitamins that you might be taking in large amounts. But just know that you're not going to get benefit from it because your body only has a certain capacity to absorb vitamin C. And you know, there are other potential sequelae. So vitamin C is actually also metabolized, for example, into oxalate, which is problematic for people who might be predisposed to form kidney stones. So as you get into this and you, like for instance, health professionals, you realize that megadoses have more potential side effects and adverse effects than possible benefit. And I think I like to caution people against taking too much because we don't know everything, but there's so many examples of how high doses can potentially cause problems that it seems like you should be wary about that. Okay. Of course, I have some exceptions. B12 is one that I will regularly see in megadoses, particularly for people or supplements for people whose age is 51 or older. And that's actually something that's recommended, meaning higher doses of vitamin B12. I do see some in ridiculous amounts, 5,000 or 10,000 percentage of the daily value. I think that's probably a little unnecessary, but supplementing with vitamin B12 is actually recommended by the US because it's known that people 51 or older some people may not absorb it as well. So I am okay with larger doses of B12, and I see that regularly. It's actually hard to avoid because it is water soluble, so you're not going to store it. There is no tolerable upper intake level for vitamin B12, and a lot of people 51 years of age or older may not absorb it as well. And then vitamin D, I'm also going to put there as an exception because in the setting of bronchiectasis and NTMLD, we are actually recommending that people try and achieve higher levels of vitamin D for possible immune benefit. And usually that means taking more than the US RDA, and sometimes even more than the tolerable upper intake level, which is 4,000 international units of vitamin D a day. But some people currently need that in order to stay in the normal range. So knowing that, I would say just stay tuned with vitamin D to see how that changes over time. But currently, these are generally the two exceptions that I make when I'm looking at supplements. Okay, third red flag, high price does not necessarily mean high quality. Consumer lab tests have shown that some of the best quality products are not the most expensive. And you'll see that with their recommendations a little bit later on. Some of the highest price supplements failed the consumer lab tests, and big retailers and wholesalers can offer good store brand products, which tend to be more discount or low cost, because they can produce high volume and they're able to hold manufacturers to high standards because they are providing so much business. Okay. Fourth red flag is that labels don't always specify how much you're getting. And I didn't write as much here, but so for instance, with magnesium, magnesium citrate, first of all, there are many different forms of magnesium. And they come typically in conjunction with, they're paired with something in a compound. So magnesium might come as citrate. And the bottle you're taking might say, let's say, I'll make this easy, 100 or 1,000 milligrams magnesium citrate. But what it should specify is that only 11% of that magnesium citrate, or 1,000 milligrams, is actually magnesium, which is what you're trying to get. So if you're taking 1,000 milligrams of magnesium citrate, you're really only getting 110, I hope I did that math right, milligrams of magnesium, or elemental magnesium, which is what you want to get. So don't just take the amount listed at face value. See if you can really dial it down to the actual ingredient that you're trying to get, and it should specify. This is also really common with EPA and DHA, which are the well-known omega-3 fats that may be anti-inflammatory. And so what you'll see is, you may see a bottle of omega-3s and they'll say omega-3s 1,000 milligrams per tablet, but they don't specify how much EPA and DHA are in each tablet. Or you might make the false assumption that 1,000 milligrams of omega-3s means you're getting 1,000 of the EPA and DHA, and that's generally not true. So with omega-3 supplements, you want to look for the line items where it says EPA and DHA and combine those two. And in general, you're looking for about 500 milligrams a day of those two combined within an omega-3 supplement to meet your RDA. Okay. 5, there are a lot of meaningless claims. This one's rampant. Consumer Lab pointed out a couple of them that they see a lot of. One is the statement or the claim that a supplement contains clinically tested ingredients. This does not mean that they're clinically proven. And even if they are proven, keep in mind the supplement might not contain what was proven to be efficacious, meaning it might not contain the correct form of the supplement in question, or the right dose of it. So it's easy to be misled. Also, Consumer Lab has seen statements saying that supplements are tested by an FDA-approved laboratory. Just know that the FDA does not approve laboratories. So again, be very wary of claims. And then know that claims to treat or cure a disease should be, they're very limited, they're regulated. So supplements, because they're not considered drugs, they cannot claim to treat, cure, or diagnose a disease. So if they do, then you should be skeptical. The claims that are allowed are a few. So the best claim are authorized health claims. These are claims that have significant scientific agreement behind them. They are allowed, and they're limited to supplements that may reduce the risk of disease. So the ones that I'm aware of are calcium and vitamin D supplements are allowed to contain authorized health claims regarding reducing the risk of osteoporosis. Supplemental folate may make claims regarding reducing the risk of neural tube defects. Stanols and sterols may also reduce the risk of heart disease. Similarly, soluble fiber may reduce the risk for heart disease, for instance, psyllium husk. Okay. There are also qualified health claims. These have limited or little scientific evidence. They are allowed with a disclaimer regarding the level of evidence. So as an example, a couple of qualified health claims are for psyllium husk, which the claim would say, based on very limited evidence, may reduce the risk of type 2 diabetes. EPA and DHA is another qualified health claim that's allowed. And the specific claim is that these may reduce the risk of heart disease by lowering blood pressure based on evidence that is inconsistent and inconclusive. So you'll notice that the claim is there, but there's also this disclaimer that the level of evidence may not be great. And then vague claims are allowed. These are claims that describe how a supplement acts to maintain the structure and function of the human body. And then there also should be a disclaimer saying that the FDA has not evaluated the claim. So again, that's you could be easily misled to believe that something is true when it's just a vague claim about how an ingredient in a supplement might actually affect the body, but it hasn't really been substantiated, nor has it been evaluated by the FDA. Okay, so moving on to supplements to consider. This may not come as a surprise, but it may seem like basic advice, but a good age-appropriate iron-free multivitamin, multimineral, I actually think it's completely reasonable, particularly in people who have bronchiectasis and NTMLD or other underlying chronic health issues. And the rationale is that it may be nutrition insurance or a safety net. And so what I mean by this is that most people are not consuming the perfect diet. They're not consuming diets that meet 100% of the daily value for all of the important minerals and vitamins that we know about. So if you take a good multivitamin or multimineral, then you'll be filling in some of the gaps between your diet and what the recommended amounts are. Why I think this is appropriate for people with bronchiectasis and NTML lung disease is because your needs may be higher when you are fighting a chronic and or acute infection. Your immune system is working hard and it needs to be replenished and refueled. And so the nutrients that it consumes mean that, well, the fact that you're consuming these extra nutrients with these extra efforts mean that you need more than the average general population who doesn't have bronchiectasis or NTMLD. Additionally, you may be having more losses of nutrients than people who don't have to fight these infections. So you might be losing the nutrients in your urine. You might be losing them through your gut. You might also not be absorbing them as well because of the inflammation that may be occurring at one point or another, or that is low grade over time. So I do think it's appropriate to take one. We also know that some existing evidence shows that supplements of several nutrients may reduce the risk or severity of some viral infections, especially among people with inadequate intake. And I'll highlight this because it seems to me that when supplements demonstrate a benefit in clinical trials, it's more often than not that the benefit is among people who started low to begin with. And so you could argue that, you know, well, if I'm eating a good diet and pretty replete, that I don't need one. And that's a reasonable argument. But to my points above, I think a lot of people aren't perfect on every day, and your needs may be higher, whether you have an infection related to bronchiectasis and NTMLD, or just get another cold virus or flu or pneumonia. Okay, so the top picks from Consumer Lab are these. So they actually recommend the Walmart brand, which is Equate Complete Multivitamin for adults 50 years and older. And I picked these because I felt like that was appropriate for the audience. It's very cheap. So is Target's. They're up and up, adults 50 plus multivitamin, 4 cents a day. And then I often recommend Centrum Silver. The fact that I just actually learned about the Walmart and Target brands. I did check them out online, and they're kind of knockoffs of Centrum Silver. They're the generic brand, so they're cheaper, but they essentially contain about the same amounts of a wide variety of minerals and vitamins. And the supplement is iron-free. And I'm choosing iron-free because the current thinking is that supplemental iron, not iron from the diet, may predispose to NTM infections. And the basis for that is that it's been demonstrated in test tubes that these organisms tend to thrive when there is iron in the medium, supplemental. So we think it may be sensible and or prudent to avoid supplemental iron, particularly in men and women particularly who are postmenopausal and don't need any extra iron. So occasionally I see women taking women who are 50 years or older taking prenatal vitamins, and that's definitely not needed. And because they're often loaded with iron, as well as large doses of other things that may not be necessarily needed. But any one of these three or their equivalents would be recommended. Okay. Vitamin D3, this again may not come as a surprise, and I put down 1,000 to 2,000 international units a day. That's like a maintenance dose that you would take daily. That assumes that you're not starting with a deficient or insufficient level. You may need more than that in order to replete yourself. But once you're replete, in order to stay normal, a 1,000 to 2,000 international units a day might be good. That is more than the RDA, but it's not close to the tolerable upper intake level, which is 4,000. And as I mentioned before, I'm not necessarily even particularly concerned about that because we've seen people need more to achieve normal levels. There is evidence from several clinical trials and pooled studies that show that vitamin D supplementation lowers the odds of developing acute respiratory tract infections by a large amount, 12 to 75%, and may reduce the symptoms and duration of those illnesses. Again, the benefits have been greater in those with a vitamin D deficiency. So, and this comes from the Harvard School of Public Health. Additionally, it's worth considering a vitamin C supplement. Let me say this before I forget. A lot of the multivitamins contain these, the ones that I'm mentioning in them. So I don't necessarily recommend you take extra. Maybe in the case of vitamin D, it might be recommended, but you can get a decent amount of supplemental vitamin C in a good multivitamin. Therefore, you would not need to take extra. So I'm trying to give you some amounts here so you can kind of compare based on what it is you're interested in taking. As I mentioned before, you don't want to take more than 250 milligrams at any one time, and you don't want to exceed 2,000 more than 2,000. That should be milligrams, not international units a day for vitamin C, because that's a tolerable upper intake level. Know that the RDA is 75 to 90 milligrams a day. So if you find a good multivitamin, that meets about the RDA or is close to it, and then you eat a decent amount of fruits and vegetables that are high in vitamin C, then you're probably, in my opinion, doing a good job and wouldn't necessarily need extra. We know that vitamin C is good in terms of acting as an antioxidant and limiting inflammation and tissue damage associated with immunity. So all these things would be good for immunity. And there are some studies that have shown that vitamin C may reduce the incidence, meaning you actually getting a new respiratory tract infection. What I think I was taught was that it's more likely to reduce the duration of the illness once you get it. And I think it's even been shown that you have to be taking it before you actually get sick, rather than starting it once you get sick, to be most beneficial. And the benefit is likely greater in those with low levels of vitamin C. So I do think, though, this one is one that you can more easily supplement with your diet, because almost all fruits, a lot of vegetables are high in vitamin C. Okay. Zinc is something to consider because of its how essential it is for the development and function of cells that mediate immunity. I put 10 to 30 milligrams per day here as kind of my recommendation. The RDA is 8 to 11 milligrams per day. Just don't exceed the 40, which is a tolerable upper intake level per day. And as I mentioned before, a lot of supplements, zinc supplements, do exceed that. So I put 10 to 30 based on the studies that have shown that zinc also may reduce the incidence, which means the occurrence, the actual getting a new respiratory tract infection, and the duration of the illness. I mentioned here the benefits seem to be greater in people who are lower to start. So I think 10 to 30 is reasonable. And I think, again, you might find this in a good multi-mineral / multivitamin. And I know that these are available on the market. Nature Made makes a 30 milligram per day supplement, and Nature Made is third-party certified by USP. So I will sometimes steer people in that direction. Okay, I also put down probiotics, and this is because we routinely think the benefits potentially outweigh the harms here, especially if you're taking antibiotics. So they may prevent a C. diff infection. They also might prevent other GI distress like antibiotic-associated diarrhea. At National Jewish, we often recommend Gyrodophilis, which is an over-the-counter supplement. You can take 2 of those twice a day, just not with your antibiotics. So we usually will say take them with your meals and not with your antibiotic therapy, so they don't counteract each other. The probiotics, however, though, are they're emerging, and I will try and do some more research and get more current up-to-date information for a talk for next year. I just think to some degree these probiotics are a little bit of trial and error, and you can try and find one that has a good variety of strains and a good quantity amount, other words, of actual colony forming units in order to get the most benefit. Okay, I'm going to throw this in there too, because a lot of people I see are postmenopausal and they're women. And I do think there is a case to be made for taking calcium plus vitamin D in women who are postmenopausal. This is controversial, but this is my recommendation, and I based it on Dr. Beth Dawson-Hughes. She's cited in my next slide. But essentially, what we know from the Women's Health Initiative study is that calcium-only supplements do not seem to protect against fractures, particularly hip fractures, which is what we're concerned about. But they do lower bone turnover, which is a measure of bone loss. So your bones are being deposited as well as broken down. And if they're broken down at a higher rate than they're deposited, then you tend to have more breakdown. So calcium-only supplements seem to improve this by a little bit. But more importantly, supplemental calcium with vitamin D seems to be effective in lowering fracture rates, specifically hip fractures, in women of ages 50 to 79, based on the results from the Women's Health Initiative. And specifically, 1,000 milligrams of supplemental calcium carbonate, which is kind of like a slow release form, with 400 international units of supplemental vitamin D a day, taken in divided doses. So you only take 500 milligrams of calcium at one time, because that's about how much your body can absorb at one time. So you would take 1,000 in 2 doses, 500 each, is effective in lowering hip fracture rates in women in the age group in which I typically see people with bronchiectasis and NTMLD, and my resources at the bottom. So this, I think, is something that tends to evolve, but I think the possible benefits outweigh the harm in this case. And I will add an addendum here to say that most people I see are getting, 300 to 500 milligrams of calcium from their diet. And so I also think it's reasonable to only take half this amount. I myself, being postmenopausal, take a Citracal tablet at 600 milligrams of a slow release calcium a day with 400 international units of supplemental vitamin D3, because I know I get approximately half of what I need from my diet. So again, I think, as I said before, I think you have to weigh the benefits versus the harm. And I think in this case, my assessment is that benefits possibly outweigh the risks. Okay, that's it for now. And I know I didn't cover hundreds, if not thousands, of other potential supplements, but I think I would say that there may be more harm than benefit in those, if only a financial harm, but possibly other harms, and they may not be needed. And we don't like seeing people I personally don't like people taking a ton of supplements when there's a lot of other things they may be taking, and there may be interactions and contaminants. It seems to me like there are a lot of potential downsides. So that's what I've got. Happy to take questions.
Okay, let's get started. Michelle, somebody would like to know if you make telemed appointments.
Oh, I do. Yeah, I do.
Okay.
And Amy, maybe Amy could connect you with me. I'd give you my personal email.
Okay. Yeah.
Okay.
Yes. You give
Okay.
me the contact information, and then anybody who would like that information, please email us. And you can just email amy@ntminfo.org, and we will make sure to get that information to you.
Thanks. Thanks for your interest.
Okay, great. Antibiotics have given me diarrhea. What can you recommend? And have you heard of using dried banana peel powder?
Oh, yes. So yes, the answer is yes. There's a product called Banatrol. I don't know if that's what you're taking, but it's a banana fiber. And it can really help with diarrhea that's associated kind of with an intervention like antibiotics. And it's safe to use long term, and you can titrate it up so you can use more of it. The Banatrol, that is, and you can buy that online. If what you're taking is similar, then I'm thumbs up on that as well. So I do recommend that. You know, one thing to do when you have diarrhea is to potentially, especially if it's really difficult, really severe, talk to your provider team and see if they would consider adjusting your regimen. They may not, but that's always worth asking. And then also try and reduce other behaviors that might exacerbate diarrhea. So like a lot of times people are on sugar alcohols that could cause problems. People might be on a lot of, apple juice in particular is high in sorbitol, which could exacerbate diarrhea. Some people are taking a lot of fiber, either in their diet or as a supplemental form. Some people are on a lot of magnesium, which has a laxative effect. So I also look for things that could cause diarrhea and try and minimize those, and then try and treat the diarrhea either with probiotics or potentially Banatrol, like what you're taking. There's also Imodium, which isn't great, but again, if this is kind of a short-term management piece, it's okay to try different things and use what works while you need to get through the treatment.
Okay. What do you think of colloidal silver?
Oh gosh. I don't recommend colloidal silver because we've seen people who end up essentially inhaling this, and it could potentially end up in their lungs. So that's a potential problem with it. Actually, what is the form of colloidal silver that they're taking?
They didn't specify.
Okay.
I mean, yeah, this is a question that comes up every once in a while. I know that the two forms we've heard of are a tincture, like a liquid, that they ingest, which I don't know all of the side effects. I do know that there are reports of people actually turning blue, and the skin discoloration is permanent. And the inhaled form, which is really discouraged because people seem to think that if they put the silver in their lungs, it has an antimicrobial effect. And even filters, for example, that are impregnated with silver do actually eventually grow a biofilm. So it's not a permanent solution. And then if you combine that with a patient that already has trouble clearing their lungs because they have bronchiectasis, now you have silver sitting in their lungs against their lung tissue, and it can cause tissue damage. So those are the things that have come up in conversations in other presentations that I've attended.
Okay, thank you.
That's all I've heard.
No, that's great. That's actually great information. And so this one's popular, particularly among more, alternative therapies. And I think we see the risks outweighing the potential benefits to a significant degree. So yeah, that's my opinion as well. Thanks for that info, Amy.
No problem. Have you heard about any research on CoQ10 for NTM?
I haven't. Yeah, the answer is I have not.
Okay. We'll have to take a look and see if there is some out there. Your thoughts on an NAC supplement for lung disease?
I know. So I see this one a lot. This is N-acetylcysteine. Um, I think this one is potentially reasonable as an anti-inflammatory. I think that's the basis for this. Um, some providers in our interstitial lung disease clinic actually recommend this. So for those reasons, I'm on board with it. I would, and I didn't mention this during the talk, but I'll mention it now. I would recommend anyone who's interested in on an ongoing basis in supplements, or who's taking a number of them, or taking some that might be more questionable. I encourage people to actually get a subscription to consumerlab.com. In addition to seeing what you can find online from the NIH, that is a good information source. But checking out NAC on consumerlab.com would be worth it. I could actually do that, but not right at the time being. But as a general rule, I am okay with that one as an anti-inflammatory.
Okay. And as always, if you are taking supplements, make sure you tell your doctor and or pharmacist, because there may be drug interactions, so they may tell you to take it at different times. Next question. This actually it's a two-parter. Somebody first asked, what about Spring Valley? It does not have certification, but it says strict quality guidelines. And then a little further down, they say, I Googled Spring Valley. The rating is horrible. Can you recommend an affordable brand for biotin, calcium, and vitamin D?
Okay, well, I'm glad you checked. It sounds like you might want to switch, which you're considering. So you said biotin, calcium, and vitamin D?
Yeah, and they're I guess they're looking for an reasonably affordable alternative. Some of them are bank breaking, I guess.
I know. So I like Nature Made because they're widely available, and they're often on sale, and they tend to be one of the more reasonably priced. They're third party certified by USP. The other thing I was going to tell you is you can get, like, if you went on to the USP website, they'll list the supplements that they test. And so you can look at those and then potentially look at how much they cost online, like on Amazon, to get some idea of price. But that's another way to kind of go about getting some good information about which ones have been tested. You can just go to the third-party certifier website that you like, a reputable one, and see which supplements they've reviewed.
That's good to know. Thank you. What amount of kelp is safe or recommended to take daily and or weekly? It seems to come in a standard 650 microgram dosage, but I've read that amount is way too much to take daily. And what do you know what the side effects are of too much kelp?
Kelp is a seaweed, I believe, and seaweed is high in a lot of minerals, potentially vitamins too. Iodine might be actually an issue. So I don't see kelp a lot, interestingly enough, and so I don't know. I would have to look into it myself, but I have a feeling it might be a mineral toxicity issue.
Well, let me ask you, let me just diverge for a moment and ask you a quick question. If you have a supplement like that just seems to be like, let's take for example, let's take the biotin supplements, which just seem to have a lot more than you need. Can you just take it every few days, or once or twice a week to get what you need from it? Is that something that can be done, or is that?
Yeah, in theory, yes. It's just that in the case of like biotin, for example, 5,000 is so way beyond any normal. It would be like, okay, taking it maybe once a month, but that doesn't make sense because it's water soluble. So, the answer is in theory, yes. But in some cases, the amounts are so high, it's hard to divide it out appropriately.
Okay.
But that might be true of the kelp, for instance.
Okay. What are safe amounts of selenium daily or weekly? Is 100 micrograms daily too much? And what are the side effects of too much selenium?
Yeah, so selenium's a good one. Let me see if I should try, maybe I can, let me exit full screen. Oh, except I'm still, Am I still screen sharing? No, you are,
No,
right?
I am. Yeah.
Okay, so let me see if I can. Okay. Am I still there?
Yes, you are.
Okay, so let me look up. So selenium I'm aware of because Brazil nuts have a wide range of selenium content depending on where they were grown and in what conditions. And you can have a selenium toxicity. I just forget right off the top of my head, but I'm going to look this up. Maybe I could start doing this since I figured out how to get online here. Okay, so I will often go to the National Institutes of Health Office of Dietary Supplements. They have good information on minerals and vitamins. And the RDA for selenium for adults 51 years of age or older is 55 micrograms. So what was the amount?
Hang on one second. Let me just look that up for you on the question.
Yeah, and then I'm going to look at the...
It's 100 micrograms daily.
Okay, so that's twice the RDA. Let me see if I can find, here we go. The tolerable upper intake level for selenium is 400 micrograms. So for adults 19 years of age or older. So, sorry, the dose was 100 micrograms, Amy, you said?
Yes, yeah, 100
Yeah.
micrograms.
So then in theory, that looks okay to me, as long as you're not eating a lot of Brazil nuts.
Okay.
I'm serious. Some people love Brazil nuts, or they'll buy the mixed nuts that have a lot of the Brazil nuts and eat those. In general, you want to eat like 1 or 2 Brazil nuts a day to avoid potential toxicity from selenium. So the other question was, what are the effects? And I'm just going to read this from the NIH site. It says early indicators of excess intake are a garlic odor in the breath and a metallic taste in the mouth. The most common clinical signs of chronically high selenium intakes are hair and nail loss or brittleness. Other symptoms include, probably less commonly, lesions of the skin and nervous system, nausea, diarrhea, skin rashes, fatigue, irritability. So hopefully that's helpful.
Well, it certainly makes me want to avoid Brazil nuts.
Oh, but okay. So I'm crazy. I eat 1 or 2 Brazil nuts every day to get the selenium. No, because it's such a good source, but I don't eat more than that. Yeah, that's me.
Well, and actually, I think Brazil nuts are also known to contain higher levels of radium and potassium.
Radium.
Which is the radioactive element. So
okay.
You might end up with a very youthful glow as well. How much vitamin D3 should I take? Is 2,000 too much? And they didn't specify, I guess 2,000 IUs.
I think that's a good amount. I will usually recommend 1,000, but in anyone who might have increased needs or who has demonstrated a low level in the past, I think 2,000 is a completely reasonable dose to take.
Okay. Are the gummy form of supplements okay as long as they are in your recommended brands? This is from somebody who has a swallowing disorder.
Oh, that's interesting. You know, as I was doing some research for this particular presentation, Consumer Lab actually was cautioning against the gummies. And I think it was because what I recall is, and if I can't find it, then I'll just tell you what I recall, but I remember them saying the gummies were more problematic in terms of actually containing the amounts of the minerals or vitamins that they said they contained. And I'm looking at it actually right here. So yeah, gummies. Hold on, let me make sure there was nothing else. Consumer Lab wasn't keen on gummies, but I understand if you have a swallowing issue, then here we go. Let me just read this. Gummies are notoriously difficult to manufacture because it is hard to measure in the correct amounts of vitamins and minerals. Some are simply sprayed on a candy base, and the ingredients in a gummy are more likely to degrade. So manufacturers sometimes intentionally put in more than the listed amount. And then they talk about some gummies that are good, like Smarty Pants, Puritan's Pride, and Walgreens. So I don't know if that helps. I mean, if tabs are not an option, then they're not an option, but it may be worth trying to get a subscription or talking to someone who has a subscription and looking at the one that you want to take and see if it was tested, or picking one that was tested for good quality to make sure that it seems like you're getting the most out of it.
Yeah. And again, just to reiterate, Smarty Pants, Puritan's Pride, and Walgreens, you said were brands that Consumer Lab seemed to indicate were a little bit better.
Yeah, particularly for their multivitamins.
Okay. All right, great. Next question. I take Centrum Silver and it does include iron, 8 milligrams. It seems to be a small amount. Is that still okay?
I wonder if it's the Centrum Silver 50 plus that has the iron in it. I think Centrum Silver just by itself does not, or at least that's my understanding. So check which Centrum Silver you're taking. You might be able to take another one that is iron free. Having said that, 8 milligrams is the RDA for postmenopausal women over the age of 50. So having said that, it's probably okay. We just prefer people to not take it. So I think our ideal recommendation is get on a Centrum Silver that's iron free, but 8 milligrams a day probably isn't as harmful as something that's 18, which is milligrams per day, which is typically what you'll see in the just regular adult women's vitamin for premenopausal women.
Okay. I take vitamin C as a sorbate because I think it irritates my bladder less than the other kinds, but it doesn't seem to come in caps less than 1,000 milligrams. What are your thoughts on that?
I don't. So then you're just enriching your urine.
Okay.
Can you cut the cap in half?
I don't know. But
so if there's a way, if there's a way to break that, then that's probably what I'd recommend. Otherwise, you might just have to realize that you're wasting some of it.
Okay. Can you please repeat why zinc should be less than 40 milligrams a day?
So because that is the tolerable upper intake level that's set by the US government. In terms of anything below that on a daily basis seems to be safe and potentially beneficial, as I mentioned. But above that, and what you can end up with is a copper deficiency, as well as there are GI side effects associated with excessive zinc, and zinc can interfere with other medications you might be taking, including the oral antibiotics that you may be taking for NTM or bronchiectasis.
Okay. I take calcium and vitamin D in separate supplements so I can try and get the right total amount. Is there any reason they need to be in the same capsule?
I like them taken together, or at least taking some of that vitamin D with the calcium, because the D helps you absorb that calcium at the gut level, which is exactly where you want to absorb it. So from my perspective, it's best if they go together so that when that calcium is in your gut, it will be absorbed because it's being facilitated by the vitamin D that's there as well. So you may not need to take all the vitamin D with the calcium, but if you could take some of it. And so the way I get around that is I just get a calcium that has some vitamin D with it. And then I take actually extra supplemental vitamin D in addition to that. So sorry, what was the second part of that? You said they tend to split, but
they were just wondering why they should be taken together, because they take them as separate supplements so they can get the right amount total.
Okay, got it. And just know that, like I said, the D facilitates the absorption of calcium in the gut. So you want the D there when the calcium's ready to be absorbed.
Okay. Just out of curiosity, can you just take both capsules at the same time?
Yeah, you can.
Okay.
So I'm not
So
sure what this situation is, but it sounds like they're trying to get the amounts, and I'm wondering if there's a way to do it so they can still take some vitamin D with the calcium.
okay, great. Um, Hi, Miss MacDonald. May I take a supplement that I like at a higher level than you have just said is the upper limit, such as a vegan vitamin D at 5,000 IU, to give just one example, if I take it every other day?
Yes.
Okay. What about fish oil supplements? Is somebody's asking, what do you think of fish oil supplements?
Right. I was thinking about this after I put the presentation together. I prefer people eat fish because that's where the biggest benefits seem to come in. That's for general overall health. From a supplemental perspective, especially if you're vegan and you don't eat fish, then I still like supplements. I still like them as supplements. I didn't necessarily put them in there as one that I recommended because the main reason is I'm hoping people will get them from their diet, either from the fishes and seafood that's higher in omega-3s and ideally lower in mercury, and some of the plant-based sources, although those are other forms of omega-3s that are helpful, like in flax or chia or hemp seeds or in pecans and walnuts. Those aren't quite the same omega-3s as are that are in fish and seafood. So having said all that, I still do think highly of omega-3 supplements, as long as you're not taking too much, because they can pose a blood thinning or a bleeding risk if you're also on blood thinners or have any issues with anticoagulation. And so generally you don't want to be taking more than, say, unless it's therapeutic and prescribed, but I generally don't like people taking more than 2,000. I believe it's 2,000 or maybe 3,000 in that range a day. Otherwise, if you're trying to get them in your diet, like I said, and you're vegan or you don't eat fish and seafood for other reasons, allergy or otherwise, then I do think it's appropriate to try and get EPA and DHA in a form that you're okay with, because they do come in an algal form. You can get a DHA vegan form, and you're looking for 500 milligrams per day. So that's not 500 milligrams of omega-3, that's 500 milligrams of EPA and or DHA, ideally a combination together daily to meet the RDA. And I should state that EPA and DHA do seem to play important roles in immunity. So that's another reason why I probably favor them as well, but especially if you can't get them in your diet.
Okay. Next question. What is the difference between the milligram number and the RDA milligram number?
So the RDA is the RDA.
That's a recommended daily amount.
Yes, that's the recommended daily amount that should help, that should help most of the population meet the need that's recommended for not only good health, but to prevent chronic disease. And sorry, what was I going to say? Oh, the levels that I mentioned in the talk, like specifically for zinc, for instance, I'm thinking that was my recommended amount, because I know what the RDA is and I know what the tolerable upper intake level is. And I also know what some of the studies have said in terms of providing benefit. So I provided my recommendation.
Okay, thank you. What about Floristore probiotics while taking antibiotics?
Yeah, so Floristore is one that and both anecdotally and in the literature, I've heard might be helpful for preventing antibiotic associated diarrhea. So I like that one. I would take it separately than the oral antibiotics that you're taking, so that they don't counteract each other.
Okay. Since we can't drink coffee or tea, is it okay or advisable to take green tea extract capsules or green coffee bean extract? I didn't even know there was a green coffee bean, to be honest.
Yeah, so green coffee bean extract, I think, was promoted by Dr. Oz a number of years ago, if I recall, like 2013 timeframes. When I remember hearing it a lot about it. But what I'm hearing this person say is maybe they're avoiding caffeine from a reflux perspective. So they might want to take, did you say a green tea extract?
Yeah, in the capsule, yeah.
Right. So my first question is there might be caffeine in there. So check whether or not there's caffeine. It certainly seems possible if there's.
I think that might be what they were going for, because if they can't drink the coffee or tea maybe because of GERD or reflux issues.
Right. So then if the capsule contains caffeine, then it's not necessarily benefiting you it's not helping, because the caffeine is still a reflux problem or trigger. So if caffeine's the issue, then I don't think the pill's necessarily helping you. If there's another issue, then then I would just check the quality of whatever extract you want to take. And the green tea extract, green coffee bean extract, I think that came with purported like weight loss benefits, meaning if you were trying to lose weight. And so that's not necessarily something I want to recommend. So I don't quite understand the rationale behind taking those, but I think I'm advising caution, because the caffeine could be problematic, and I certainly don't want to potentially promote weight going in the downward direction.
Okay. And somebody actually made a comment just below about Florastor. It says Florastor's literature says that it should not be used by people with PICC lines or ports, and they found that information on their insert.
That's interesting. That's not something that's come up for me before.
Yeah, I haven't heard that before either.
Yeah, so maybe that's just an infection risk.
It could be. I know that one of the recommended brands, certainly National Jewish recommends Jarrow.
Yeah.
Gyrodophilus is one of the brands they recommend.
That's right. And so I'm going to go with what the insert says. I have not found that. I don't know anyone who's had that problem in clinical practice, but I haven't seen everybody. And I don't see a lot of people taking Florastor. I just know that what I'm familiar with is the potential benefits for reducing antibiotic-associated diarrhea. But certainly if you're
and somebody was asking specifically, was there a probiotic that you specifically recommended during the webinar?
Yeah, so I mentioned what you just mentioned, Amy. And
Jarrow.
That's the Jarrow. There are other ones out there, but I think as a starting point, that one is likely to be a little more affordable and not super, super potent, because sometimes if you take too much, then that can also cause problems. So if you can start with something maybe that's more mild and see if you tolerate it well and see if you think it helps, and then move to a more potent brand if you think that's necessary, that's probably a good starting point.
Yeah, and I know that Jarrow has different formulations. They have different strength formulations. So you can actually try a step-up process where you start at a lower dosage of probiotic and work your way up so that your stomach doesn't go into shock all of a sudden. What are the risks in taking the calcium supplements that you referred to? What are those risks that you had mentioned?
What are the risks? So my understanding is that the cardiovascular disease risks are probably not a concern. However, that still comes up. So in the interests of increasing your margin of safety, I would say that. The other thing that comes up for me is I know Harvard has some concern with people, in particular men, taking more calcium because there may be a relationship between high calcium intake and prostate cancer risk, particularly the advanced forms. So in general, I don't recommend that men in particular take more than 1,000 milligrams of calcium per day, and I try and do diet and supplements combined with that. Of course, you have to look at each case individually, especially if someone has had a history of fractures or that severe osteoporosis. But I'm thinking of potential cardiovascular risk. I'm thinking of prostate cancer. On the flip side, I think, and there's always more than one thing to consider, but I do think that supplemental calcium has benefit of potentially reducing colon cancer, the risk of colon cancer. So that's another potential benefit. I know that's not what you asked, but in terms of me going through my filing cabinet for the potential risks, I think of the potential cardiovascular, and I think of prostate, especially when it comes to men. And I'm trying to think of, so off the top of my head, that's what I'm going to say.
Okay. All right, thank you. Is curcumin 2000 or 1000 milligrams together with black pepper extract 10 milligrams beneficial to your health if you have NTM?
So my understanding is that the curcumin, particularly taken with black pepper for, I think, good absorption, is potentially an anti-inflammatory. So I think that's one consideration. I can tell you that some of our providers in the ID clinic at National Jewish don't like the turmeric and the curcumin because they think those might be particularly caustic to the lungs, in addition to silver and some other things that you could potentially aspirate, especially if you're using a lot of fluid when you're taking supplements. So I think what I'm going to say there is maybe run that by the provider that you're working with to try and weigh the potential harms versus the benefit of that.
Okay, that's a good point. The GERD risk. What is the dosage for NAC, for N-acetyl
A good question.
cysteine?
Yeah, let me see if I can. What I'm going to say off the top of my head is 600 milligrams, but I'm not sure if that's correct. And that's what's coming up when I'm looking. I'm going to guess, I think it's 600 milligrams.
Okay, and somebody actually wanted to know if you could look up Kelp while you're on that reference page as well.
So funny. Okay, let me see what I can do here. Let's look up Kelp. We are live looking up Kelp. Okay. Kelp. Iodine from Kelp. I thought that was the issue. Let's look up, let me look up both these here, see if I can pull up. So Consumer Lab does have a Kelp supplements review. Kelp supplements may contain small amounts of a variety of vitamins and minerals, but they are primarily a source of iodine. Okay. You don't have to take a Kelp supplement to get iodine. Taking a supplement containing potassium iodide, common in multivitamins, is just as good and may be a safer choice since you're more likely to get the listed amount of iodine. There is less likelihood of contamination with arsenic or other heavy metals. And iodine from Kelp appears to be absorbed only half as well as that from a potassium iodide supplement. Nevertheless, if you prefer a natural source of iodine, a carefully chosen Kelp supplement can be fine. So let's see what the top pick is. Swanson Kelp. 1 cent per tablet. And it's saying that the tablet form may be better than a powder Kelp form in order to reduce the risk of potential arsenic contamination. Okay, so hopefully that's helpful.
Okay. Yeah, somebody's saying that they were advised 600 to 900 twice a day. They have severe cavitary NTM and they've had multiple surgeries. I don't know.
Okay.
So
okay. that's maybe a little bit more than I thought, but it could be based on their condition.
Yeah.
Yeah.
Thank you for sharing that information.
Mm-hmm.
Next question in the queue, go back up. Just finished taking antibiotics for a recent infection and experienced sleep apnea. Is there a supplement to manage the effects of sleep apnea?
Ooh, not that I know of.
Hmm.
That's a new one. I don't know. I don't think so.
Okay.
Yeah, I'm tempted to actually do a quick, let's see, sleep apnea. Yeah, I'm not getting anything on Consumer Lab.
Okay. What things should you consider to ensure the calcium you take is absorbed, and what things hinder its absorption?
Oh, that's a good question. So the best thing to take with it is vitamin D. As I mentioned, it's absorbed in the gut and it's facilitated by vitamin D. Sorry, can you repeat the question again?
What things hinder its absorption is the next
Right.
part of the question.
So I think iron can be and we don't necessarily want people on supplemental iron, but there are other minerals that can potentially competitively compete with it for absorption. Iron comes to mind. And then there are things in foods like oxalates that bind calcium. And I think it can be hard on a practical level to try and be hyper careful about that. But so having said that, just know that you don't necessarily absorb everything you're taking, but if you're taking it on a regular basis, in theory, you won't necessarily be having the same potential nutrients in your foods competing with it for absorption. So over time, you're probably okay. Calcium citrate and calcium carbonate tend to be the better absorbed forms based on what I understand. So I generally have people look for those forms, and I should know this. I think the carbonate form needs more acid for absorption. So if you're on a proton pump inhibitor, might be better to be on the citrate form for better absorption.
Okay, and that actually ties into a question further down. They want to know the difference between elemental and citrate.
Okay, so elemental calcium is in calcium citrate. It's the elemental form in calcium citrate once it ionizes in your system and as it is digested and then absorbed. So the elemental form of calcium is just calcium. When calcium is compounded with citrate, it's in that form, and it needs to be broken down to its elemental form before it can then be absorbed.
All right. What is your opinion of folic acid as a supplement?
My opinion is that most people don't need it. And you can get too much. But if you're pregnant, then you likely do want to be on folic acid in a prenatal because it does help with neural tube defects, preventing them, like spina bifida. But otherwise, most people can get it from a well-balanced diet. And I just don't see a lot of folic acid deficiencies unless people are on super, super restrictive diets, in which case it does make sense to be on a good multi. So I don't think you need to be taking that one extra. I think you'll probably get it from your diet. And if not, if you're on a good multi, that's going to cover you. Oh, the other reason is folic acid is in our food supply in terms of it's enriched in our flours and a lot of our cereals. So there are a lot of, and that was done in an effort to prevent neural tube defects. So in general, I think people's diets I think people meet their needs for folate and don't need extra supplementation.
Okay. Is guayafenisin considered a supplement? It's one of the ingredients in mucines, and I think it comes from a tree, they're saying. If it is a supplement, are there any cautions about it?
You know, I do think of it as a cough suppressant. Guayafenisin. Let's see if I can find this.
I feel like it was an ingredient in Mucinex.
Yeah, so I don't think of it as a supplement. I think of it as an anti-mucolytic, right? Or cough suppressant. Sorry, cough suppressant. Hold on. How do you spell it?
No, it's actually an expectorant.
Is it? It helps you bring stuff up?
Yeah, that's what I thought it was. Yeah, it loosens mucus. That's kind of what I thought it was.
Okay, so
Guayafenisin, sold under the brand name Mucinex, among others, is a medication used as an expectorant intended to help cough out phlegm from the airways.
okay, then
It's unclear if it decreases coughing, but it can help loosen your mucus.
Okay, so I do not see this as a supplement.
No, no.
Yeah,
It may be considered an over-the-counter medication, but
yeah,
I don't think it's a supplement.
yeah, that's the answer.
Do you know anything about CVS vitamins and their effectiveness and safety?
CVS?
CVS brand, yeah.
I don't. Let me see what I can find. It looks like, hold on a sec. Their website indicates that they follow NSF standards. I don't know if CVS brand supplements have the NSF label on the front of them. So that's a question. Let's see if I can see that. And I don't see it necessarily online based on what I can see. So I do not know right off the top of my head. And something you can do, you can actually contact the company and ask who their third-party certifier is. They're saying they're third-party certified to NSF standards, and get more information that way. That's generally what I do when I can't find it otherwise. So sorry, I don't have an answer right off the top of my head.
And they also say how it's made. Our suppliers are required to manufacture products in facilities that are registered with the FDA. And I think that's actually an important qualification to make, because while the FDA doesn't, certify laboratories in manufacturing facilities for medications and other things, the FDA actually does do inspections and can shut those plants down. And I think that's actually an important distinction for people to make.
Okay.
Oh, here, hang on here. I found it on CVS.com website.
Okay.
Meet the third-party testing experts. They have UL verified active ingredients, Eurofins, USP, and NSF are the four listed.
Sorry, can you read that again? I didn't.
Yeah, there's one it says UL verified. UL verified active ingredients.
Oh, I see it. Yeah, I just scrolled down.
And I don't know what Eurofins is. And then also USP and NSF are on there.
So yeah, I'm on USP's website to see if I can confirm that, but they should have a certification mark on the supplement from the third-party certifier. So maybe check the supplement that you have and see if you can verify that. And if not, consider contacting CVS.
Yeah,
Whatever contact info is on the supplement container.
very good idea. I am taking 1,000 IU plus 45 K2 daily. Is it good for bone health as well?
I know. How much is it?
1,000 IU plus 45 K2 daily.
Sorry. Say that again. I missed the first part. How much?
All it says is 1,000 IU plus 45 K2 daily. And they're asking, is it good for bone health?
Yeah. So assuming that's for the first part is for vitamin D, then I'm going to say yes. The K2, I do think it's true that vitamin K, and I haven't dug down to the specifics in terms of which isomers or which forms, specific forms of vitamin K might be the most beneficial, but I do think vitamin K may be helpful. I don't generally tell people to put it in a calcium or a vitamin D or seek it out in a calcium or vitamin D supplement for bone health. I generally tell people to eat green vegetables. It's actually not hard to get a lot of vitamin K from the green vegetables, but you might be looking for a certain form, and I can't up K, and I can't necessarily address that. I don't think that will hurt you based on, what I know from a RDA standpoint from vitamin K, which is between 90 to 120 milligrams per day. So it doesn't sound like you're taking a huge megadose. Might be helpful. And I'm assuming the 1,000 is relating to vitamin D.
I would assume. What is your opinion of ester C? Are there any interactions with medication?
That's like 1,000 milligrams of vitamin C. So I would just say that you're going to pee out the vast majority of that when you take it. Ester C tastes good. So I don't necessarily think it's going to harm you because it's not over the tolerable upper intake level. I think it tastes good. It might help a little bit. It's just that you're taking a lot more than your body can absorb.
Okay.
And in terms of interactions, not that I know of.
Okay.
Mm-hmm.
Are chewable calcium and vitamin D okay?
Yes, they are.
Okay. Do you have any thoughts on herbal tinctures such as oil of oregano? Are the standards for tinctures any better than the ones for pills in terms of supplements?
I don't think they are in terms of the standards. And yeah, I think I don't necessarily recommend those because I don't necessarily think the benefits outweigh the potential harms with those. So the standards aren't any necessarily higher, and I don't always recommend those.
Okay.
Probably because of lack of evidence for benefit.
Okay. We actually have a comment, and I'd like you to hear your thoughts on this. Somebody commented, this goes back to the green coffee bean extract conversation and the fact that they said it's supposedly good for heart health and as an antioxidant. And then this person said, but if Dr. Oz recommended it, I'm against it. I think this raises actually, though, a very good point that we should talk about is that there are a lot of talking heads out there who are talking about these, you should try this supplement, you should try that supplement. And there's a lot of noise out there. Mm-hmm. So, and the thing with Dr. Oz is that he is a doctor, right? He's a cardiac physician at Columbia University. And this is notwithstanding the fact that a bunch of his colleagues actually wrote a letter because they really were not happy with some of the things that he was doing. Yeah. But I think it's important, for us to think about where we're getting our information from. And that if a doctor is a celebrity or a very well-known public figure, if what they're doing is for a television, like if it's for a television show, it's not necessarily that it's going to be like, who's vetting the medical advice, I guess, is the question. We're not talking about somebody who's working for a public health agency,
I know.
right?
And
So what do you do when somebody comes to you and says, oh, so-and-so on this TV show on the doctors said I should take this? How do you address these kinds of things in conversations? Because people want to try things. And I certainly have tried a couple of things when I've heard about it. I talk to my doctor about it first, and you should always talk to your doctor, especially if you're on other medications. But how do you address these issues? Because I think it's become more and more of an issue now.
Yeah. So I think ultimately you have to decide who you trust. And I encourage people to be more skeptical than not, because the supplement industry is probably a multi-billion-dollar industry, and people feel vulnerable because they may be sick, or they're invested in their own personal health and well-being and longevity. So there's a vulnerable population, most of us, and they're willing to spend a lot of money, and that's been demonstrated. So anytime you have that situation, you have a situation where people can be taken advantage of, and I'm very wary about that. So in terms of deciding who you trust, what I tell people is, if there's a potential ulterior motive, meaning there's a celebrity doctor and they benefit from notoriety, fame, as well as financial gain, then I distrust that source. That's my opinion. That's how I approach it, because I see that they have other interests that are serving them more so than serving me. And a lot of times those same people are making claims that are either too good to be true, or they're spreading, like, they're quote unquote peddling fear, or promoting fear mongering types of language. If you don't do this, then you're going to get this, or they're sensationalizing potential bad things that could happen if you're sick, or you're not getting enough from your diet, or you're not taking this. And I think that is all very questionable behavior, and you need to take that into account. So what's your source? Evaluate the source of your information, because there's a lot of well-credentialed people out there. Stephen Gundry being another cardiologist who is making a name for himself and putting out pretty significant, elaborate videos promoting his supplements. So take into account credentials. I'm not saying disregard those, but credentials are important. But then look at conflicts of interest. So are they interested in promoting themselves in any way, shape, or form? That could be fame. It could be financial, sorry. Those are the main things. And then look at their language and how they present things. And if they're presenting too good to be true scenarios, they probably are. If they're trying to scare you, they're using scare tactics, that's another major red flag for me. And then also, if they're cherry picking data and not presenting a balanced view of the potential pros and cons, or benefits versus harms, that's also a red flag. If you meet someone, typically someone in the public health sphere that's typically from an academy, Harvard, Tufts, elsewhere, and they're talking to you with an element, they've got credentials, they have fewer conflicts of interest, and they're talking to you with a reasonable voice, saying, this might be the case, but we're aware of this, and think about, this is what we know about it, but this is what we don't know, and we're not sure. That's a lot. That person has a lot more credibility, in my opinion, than someone who's trying to sell you something hard. So I think you have to be a smart consumer and really decide who you want to trust. And like I told you, good credentials is what I go with. Very few, if any, conflict of interests, and good language and reasonable, logical thought. If someone's telling you to do something and they can't explain why, that's a problem. but if someone can give you the basis for a recommendation, give you some evidence, explain why there might still be controversy, but try and take your best interest in mind, that's a completely different source of information. And generally you're going to find those sources in the academies or in people who have good credentials and good expert opinions. And those tend to be the sources that I trust.
Thank you. Do you take probiotic pills with food? So I guess, is there a certain set schedule for taking probiotics other than not taking it with antibiotics at the same time?
That's the main thing, is just separating them from your oral antibiotics.
By at least a couple of hours.
Mm-hmm.
Yeah. Okay. Next question. I don't tolerate animal-based digestive enzymes, so I resort to plant-based ones. Do you have any recommendations?
Unfortunately, I think digestive enzymes are something that we worry about people refluxing and aspirating and being very caustic to the lungs. So we don't recommend enzymes unless there is a clear medical need for them. I think you have to weigh the risks there. And I don't necessarily have a plant-based digestive enzyme that I would recommend off the top of my head.
Somebody's commenting that calcium carbonate might cause kidney stones. They've been told that calcium citrate is better. Have you heard anything about this? Or I know kidney stones are a concern for some of our patients.
Yeah. So yeah, that might be it. Generally, if you are at risk for calcium kidney stones, then a lot of supplemental calcium is probably not recommended. I wasn't aware that the carbonate form, that there was a difference between the carbonate versus the citrate form. So okay. I probably defer to your kidney doctor on that.
We have another question about calcium. Is the calcium that's found as a deposit on the heart the same as the calcium in the supplements? So in other words, could calcium supplements be the cause of those calcium deposits found on the heart?
Yeah, to be honest, I don't know exactly. I know there is there is that cardiovascular concern. I don't know if that was one of the mechanisms. It seems possible. But like I said, my understanding is that's largely not considered to be a real risk by most of the experts that I follow. However, it still comes up. So for that reason, I generally try not to overprescribe it or over-recommend an amount. And that's another reason why I will say pick a slow release formulation in an amount that's maybe 500 or 600 milligrams a day in order that you get kind of a metered out absorption of it and you don't get too much overall. And that could be good for any number of reasons.
Okay. Is there a problem or a benefit to mixing probiotics? Example, Fluorostor and Jarrow on alternating days.
I don't think there would be a problem. I don't know if there is a benefit other than you're just getting more variety.
Yeah, one thing I was actually previously told that you don't have to alternate every other day, but like every few months you should switch it up to maybe alternate your brand. You get a little bit of a different variety, because I think with probiotics it takes more than a day or two to sort of repopulate your gut.
Yeah, no, that's a good point. And I'm under the understanding too, based on my conversations with the GI doctors I work with, that generally you want to be on a probiotic for about a month to help it kind of work as effectively as it can. So to your point, maybe it's better to alternate a month or more at a time.
Okay. Somebody's asking, I have bronchiectasis and NTM with low weight loss, Are enzymes harmful in supplements, particularly in organic paleo greens? I guess they're saying by designs for health. Their line item says enzyme prebiotic proprietary blend is 118 milligrams. The line below it says enzyme blend cellulose, protease, amylase, and lipase.
And so what I'll just tell you is that Dr. Hewitt in particularly in particular is really not happy with the digestive enzymes and other supplements that she really believes might be caustic to the lungs. So I've taken to not recommending them myself unless they really unless you have a demonstrated need. Yeah.
Okay, that's good advice. Dr. MacDonald, do you think natron melatonin is best beneficial to help with insomnia?
What's the brand?
Natrol, Natrol.
So melatonin can help people fall asleep. I think there's no doubt about that. How much are they taking? Did they say?
They did not say. I think there's probably a pretty standard for Natrol. I know the brand, so.
Okay, I don't know the brand.
Hang on a second.
I'm looking at the reviews online here.
I thought I tried it once. It looks like 10 milligrams. Does that make sense?
That's a high amount. Usually people start with 3, but I've seen 5 or 10 be needed to help people fall asleep.
Yeah, 10 milligrams.
Okay, so that is a high. I would expect that to provide some effect. Let me see if I can find. And usually you want to take that 30 to 60 minutes before
you go to bed.
Yeah, before you go to bed. Okay, here, top picks. Let's see if they did a review that I can. So you said Natrol?
Natrol, yeah.
Let me see if that one was reviewed. Oh, it was. But it's the 5 milligram tablet.
Uh-huh.
And that one is approved as a good one.
Oh, okay, great. Good to know.
Mm-hmm.
All right. Well, ladies and gentlemen, that has closed out our question and answers. We are done. I would like to thank everyone for joining us throughout the year. Dr. MacDonald, thank you very much for joining us throughout the year and with these wonderful presentations. Everybody's learned a great deal. Hang on, more popping into the Q&A, some thank yous. Thank you very much, everybody. We're so glad you enjoyed these presentations. Everybody have a wonderful, safe, and happy holiday, and we will see you all in the new year. Thank you.
Thanks, Amy.
Thanks, everybody. Bye-bye.
Bye-bye.